Did I hear that there are new guidelines for pain control?
Find out today in Medical History Mysteries.
Hey everyone, and welcome to Medical History Mysteries. I'm Pam Maragliano-Muniz, Chief Editor for Dental Economics Magazine, and with me, as always, Tom Viola. Tom, what's happening?
Hi, Pam. It's good to see you. Hello, everyone. Thank you so much for joining us today. And hey, Pam, I have to tell you, a lot of people have been coming up to me at my lectures and saying, "Hey, I saw that Medical History Mysteries thing you do with Dr. Pam." And I'm thinking, wow, that's pretty cool. I do like the fact when people come to me and say that they've actually watched an episode and learned something from it. So thank you to all you folks who watch us and enjoy our content. We're hoping to do more of this and keep you as well informed as possible.
Oh my gosh, this is so much fun. And this is one of my favorite things that I do. And people come up to me as well. And I just think, this thing's taken on a life of its own. So thank you guys for joining us. Please keep watching us because if you keep watching, we keep making them. So thank you. So, all right, today we're going to talk about new guidelines or maybe not so new guidelines for pain control. Let's talk specifically though, because there's guidelines for pediatric patients, guidelines for adult patients. Today, let's focus on pediatric patients, the little peoples. So what's new?
So, and Glenn, this is going to be part one of a two-parter, right? So stay tuned for part two when we talk about pain management for adults. But, the American Dental Association, I am a big fan of the ADA. I think I really appreciate what they do. They're a great organization. They help us out. And sometimes when the waters are a little murky, the ADA published the end of last year and the beginning of this year, new guidelines for pain management. Last year, there were guidelines that were published for children. Earlier this year, they were published for adults. But let's focus on the pain management for kids, okay? So the guidelines that are published were for one or more simple or surgical tooth extractions, how to treat pain there. And the other was for, pulpitis or toothache, how to manage that pain in children only. So what did the guidelines say? Well, you'd be surprised because what's old is new again, right? Nothing really has changed. It's basically the same things we knew before, but it's good to know that the ADA reinforced our positions on how to treat pain effectively and efficiently. So the guidelines say if an NSAID is contraindicated, if you can't take an NSAID, then you get acetaminophen alone to manage that pain, okay? But if you can take an NSAID, then you get a couple of different options. So option number one is to just use ibuprofen by itself. Option number two is to use just naproxen by itself. And option number three is to use either ibuprofen or naproxen plus acetaminophen. Okay, those are your three options. Now, if you went with the first options, option one and two, and just using an NSAID by itself, you have the option of adding acetaminophen to the NSAID. Okay, and if you think that NSAIDs alone were providing inadequate pain control. But that's everything we knew before. It's just good to know that it's been reinforced, that we're not doing anything differently than we did in the past. Now, as far as treating symptomatic pulpitis, well, if there's definitive dental treatment immediately available, then again, we're going to do that, right? But if we can, if it's, right now we need to implement some temporary management of the toothache, we're going to do the same thing. We're going to follow the same guidelines. Again, if an NSAID is contraindicated, we're going to use acetaminophen alone. If we can use an NSAID, same thing. Ibuprofen by itself, or naproxen by itself, or either ibuprofen or naproxen plus acetaminophen. And again, if you went with option one and two, that the NSAID by itself was not enough, you can always add acetaminophen to either one, and therefore, choose a more aggressive approach to treating the pain. What's different, Pam? A couple things. Number one, there's no opioids, okay? The opioids are not part of the guidelines for children. And that's for good reason, because the FDA has been saying for years, do not use opioids in kids. One of the most notorious opioids we've used in children that we probably shouldn't is codeine, okay? At least in the past we did, we now know no longer. Why? Because codeine is a prodrug. It's broken down in our liver to morphine. Now in adults, it's broken down to a rather small extent, so we get a small dose of morphine. That's what gives codeine its ability to treat pain. But kids become like hypermetabolizers of codeine. They break down codeine into huge amounts of morphine and they end up getting respiratory depression from a simple dose of codeine. So we know now, no codeine, no tramadol, no opioids for kids because for the most part, kids are pretty resilient and could do pretty well with just either an NSAID alone or an NSAID plus acetaminophen. But are you ready for the biggest change I found, Pam?
I'm ready for it. Edge of my seat ready.
There's no dosages.
What?
Yeah, the ADA guidelines for children do not include the milligrams for dosing in any of these guidelines. The ADA, I guess I'm just speaking for them, maybe wants you to calculate the dose for each individual patient in a milligram per kilogram fashion. And so you've got to do the dosage calculation yourself.
Huh. Okay. So there's no changes, but the big change is you need to figure it out yourself. So there's got to be a place where we can find guidelines for milligrams per kilogram and also something you've pounded into all of our brains when you're mixing acetaminophen and any sort of ibuprofen is that we have to be safe and we have to make sure that we stay within the safe dosages for both of these. So I would imagine that the safe dosages are significantly less for children than they are for adults. So where do we do all this? This is too much.
So I get it, and that's why I wanted to make sure you and I talked about it today. So I'm glad it came up. Google is a great resource for us. So, as you would probably recommend if I had heard you say it before you said it, Pam, be proactive here, right? Go online, Google, the quick and easy dosing recommendations for ibuprofen, for acetaminophen, for naproxen, whatever it is you're going to find yourself prescribing, and find out how you do the calculation for kids based on their weight, based on their age. The tables are widely available. You can find them anywhere, but do print them out, slap them on the wall in your office, whatever, so you know where to find them, and you could do that quick calculation by yourself. The hardest part about doing it is remembering to convert pounds to kilograms. So lots of moms and dads and parents know their kids' body weight in pounds, but you got to make sure you convert that to kilograms in order to do the calculation.
Wow. What about the safe dosages? Like, how do we stay under that ceiling?
So the thing is, by calculating a milligram per kilogram basis, based on the table, it tells you what the safe dose is. So it's within this range for this weight and this age. So you just have to follow the tables to know exactly what to prescribe. But I will say, after a couple of times of doing that calculation and knowing roughly that some kids just sort of weigh the same amount, you could probably come up with the dose that works for you best. But it's a good exercise for us because we have to remember every time that whenever we're treating patients, there's no one size fits all, one cookie cutter approach to managing patients. You've got to be able to calculate dosages, certainly, but then you also have to take the medical history into effect. So if the child has an issue with their liver or their kidneys, then that's going to alter the dose as well. And that's why I think sometimes it's better to look it up to refresh in your mind. Okay, so if a child has that issue, what should I do as far as dosing? Or maybe not prescribe something and prescribe something else instead.
I think that's exceptional advice. So have that resource handy for you. Google it, look it up, do whatever you need to do, print it out, save the bookmark, whatever it is. Have it ready to go because nothing's worse than needing something and then having to stop what you're doing to look it up and then do all of the things. So I love that. Nothing major has changed other than we need to be a little bit more proactive with our systems and also making sure that we're doing the best thing for our little kid patients. So thank you for that. This was really great advice.
Thanks, Pam. Wait, let's get to the adults. That's coming up next.
Stay tuned, everybody. Join us next week where we're going to talk about new updates for pain management on adults. We will see you next week.
Take care, everybody.